Great. I'm
Okay.
going to share my screen. Can everybody see the presentation?
Yes.
Awesome. So, hi, everybody. Thank you so much again for being here. A lot of thought and effort has gone into this presentation on behalf of your incredible wellness committee, who Carrie and I are so lucky that we get to work with, led by Brooke. And Carrie and I are really here today to just support their mission in removing the barriers to your benefits. Again, this is going to be recorded, so you will have this to reference back later. And I know Brooke and I have also talked about being able to share this deck because I've built in some pieces on how you can access some of the things that we'll talk today. We're going to start with some introductions. So Carrie and I'm sure she'll touch on this too, but we love any opportunity to meet directly with members. So we are so happy to be here with you today and work through any questions you might have. So Carrie, I'm going to let you kick off introductions.
Perfect. Thank you. It's so great to have this time with you guys today. So thank you for joining us, and hopefully those who hear the recording will see some value in this as well. I am Carrie Simon. I am the Senior Account Executive who represents Bethel within the Pacific Source. And I'm here to support you guys in your experience with Pacific Source. You may have seen me at different times at the open enrollment kind of table, if you will, in the cafeteria, supporting, again, the health plan for you guys. Really, again, just thank you for your time today. We'll kind of hit on a few things. And as always, if you have any follow-up questions, we are here for you. Customer service is available. So just know that this is not the end of, of the conversation. We're always available for you. Go ahead, Melissa.
Awesome. So I am Melissa Sherry. I have been with Pacific Source for about 10 months, so still getting comfortable in my role. I am a wellness consultant here, and my job is really to support your wellness committee and Brooke in developing and maintaining strategies that help all of you be your best selves at work. So I'm really excited about what we have for you today because I feel like it can really make an impact on how you access care for both yourself and any dependents that you have on the plan. So with that, let's jump in. So really quickly, today we're going to give you an overview of what access to care that you have at the health center. We're going to kick off with that. We're going to provide information on resources specifically from Pacific Source in terms of preventive care and our member portal. For healthy resource review, we're going to talk about all of the extras in your benefits that you may or may not know about. Brooke shared that we had some questions about the gym membership benefit, so we're going to cover things like that in this section. And then we're going to close it out with a review of the tools that you have with your flexible spending account. So lots of stuff that's very exciting for us today. And now I'm going to hand it over to Brooke.
Great. Thank you. So we are super excited to have Pacific Source here, like I said, supporting this, and Nicole Zwink, a member of our wellness committee, and Roop, who's also been really instrumental in just looking at how we can support employees. So really excited to make this happen. So one of your first benefits as an employee in the Bethel School District is actually being able to access the Bethel Health Center. So as many of you know, we're located right here on the north side of Cascade Middle School. We actually have a front row view right now to the pool right there at Echo Hollow, but we have our own entrance. You're able to just walk in, look for the awning and the potted plants out front. And we are open Monday through Friday, 8:30 to 5 o'clock. So that's when we have someone here answering the phones, scheduling, doing all of that. Angela Bradley, our nurse practitioner, is here 2 days a week, seeing people. Next slide. So these are just types of care that we're able to offer here. And knowing that it's for you and members of your family, certainly partners or anything like that, but knowing that really we're here to support you as an employee in the Bethel School District. So the max amount of out-of-pocket that you would pay is a $15 copay to us. So regardless of what your insurance benefit or things look like, that's the very max that you would see from us. Now, that does not include like if we needed to send you out for labs or x-rays or something like that, because that's a different service. But within seeing Angela here at the clinic, that's what the total cost would be for max. And then these are just, like I said, a list of all the things that we see in and out here. So Angela's has a great background and skill set on managing diabetes and healthcare conditions, high blood pressure, asthma or depression. We see lots of colds. Unfortunately, we see the flu too, but ear infections. We're also able to do those annual wellness exams. So once a year is what's recommended for all of our kiddos. And then actually that's the same for adults, which you may not realize, is getting in once a year and just checking on those important things, making sure that you're healthy and sleeping well, and, you know, talking about moving your body and talking about how your mental health is going, and relationships, and, you know, all of those things that lead to overall health and wellness. We also offer reproductive health care. So we do have the Depot shot. We do an Explanon, which is the implant arm, and, you know, pregnancy testing, STI testing, any of those kinds of things that are involved there. So anyway, that's just a little bit about the services that we provide. Next slide. One thing that individuals will also ask is if it's confidential. So because we are like under, right, the umbrella of the Bethel School District, and I think this is super important for people to understand, is that the school district does not have any access to your medical information. It's protected by federal HIPAA laws, which are very strict, and that information is completely separate from the school district. So anybody in the HR, anybody in the administrative office, any of those types of things, they do not have access to our schedule. They do not have access to your medical records, any information like that. So we take that very seriously here, and just want to make sure that you know that as well, that we are certainly following the law on keeping that information safe and protected. So that's just a little bit about the Bethel Health Center. Feel free to give us a call and we can get an appointment set up for you. Lots of times, you know, if you've got like a little sick kid at home, or if it's your partner or spouse, or for you, I'm happy to see them at the health center. And like I said, we exist to take care of all the Bethel kids and to also take care of our Bethel employees. So that's why we're here. Feel free to reach out to me with any questions.
Awesome.
So with that, we'll take a moment just to do a little refresher that as a part of your actual benefit plan with Pacific Source, that preventive care that Brooke mentioned, those routine annual exams, cancer screenings, things like that, those are all covered at 100% on your plan. So you can access that through the health center or through your primary care physician that you typically see for other things. So we just always like to encourage folks to remember that those are, to Brooke's point, annual exams that are available. One of the questions that does come up is if you, for example, have diabetes, sometimes providers will call those annual checks on the diabetes piece of things a preventive visit. So just be really clear that these are specific to just general care, as to where like a diabetic follow-up exam would have a diagnosis code associated with it. So that's why there would be a copay on that visit versus these no-cost visits. So that's one of the things that kind of I like to call out and just make sure is pretty clear for folks. And then just know you also do have prescriptions that are available. We typically see those as maintenance prescriptions, and those lists are on our website, and you can have that conversation with your provider if those are applicable to your situation. But again, those would be a part of that zero cost share as well. So those are really great ways to save yourself money and make sure that your health is in check.
Awesome. So we are going to shift into some of the access tools that you have with Pacific Source. And I'm actually going to provide you time today to get logged into this stuff. So if you're having issues, you can troubleshoot with Carrie and I, and we can just get you registered on the portal. So In Touch is your member portal with Pacific Source. And by registering for this portal, it will provide you access to your entire healthcare benefit package. So this is a great resource for you to actually see what you have access to post this conversation today. You can also see the status of your pre-authorizations from your providers. This means that that process is going to be much simpler to access your healthcare treatment plan, prescriptions, or medically necessary equipment. And it's going to give you that insight that you might need to see the timeline on where that's at. Your explanation of benefits, which is just a statement from your health insurance plan describing the costs that we cover for medical care or products that you've received. So you receive an EOB explanation of benefits after every visit with your provider, and these are super easy to access with the In Touch portal. Another great feature is that you have access to your member ID card online. I use this all the time, and I don't even carry my plastic card with me anymore because it's just super easy to pull my phone up and have all that information. And your doctor's office will accept that. You can update information here, and you also have access to all the healthy resources that we're going to talk about in the next section. Okay, so if you already have an In Touch account, I'm going to advise you to open it up and log in right now at pacificsource.com. What I'm going to invite you to do if you already have that account is to poke around the benefits tab that you'll see right at the top to start looking at some of the benefits that you might not have looked at by logging in previously. For those of you who do not have an In Touch account, let's do this together. So I encourage you to go to pacificsource.com, and in the top right, like you'll see on the screen here, you're going to see a login button. And then once you get there, and all these instructions are right on the screen, and you can also pause me if you're on the call, you're going to see the member sign-in form and member sign up right underneath don't have an account. You're going to click there. And then you're going to be prompted through some personal information questions. You have a few options here. If you don't have your member ID handy, there's an option for you to use your social security number. So you can choose either whatever you have access to right now. I'm going to give you just a few minutes. And if everyone on the call already has this done, just type done in the chat. And then if you are working through it, just put in done when you're complete. Awesome. Nathan already has an account. That's wonderful.
I was just going to mention that if you don't know your membership number and you don't have your ID card handy, but you remember how to log into the employee portal called Employee Access through Bethel's website, we do have that number posted on your employee profile.
Awesome. That's fantastic. I should have got some music queued up so we'd have like some Taylor Swift in the background to dance to while we do this. No, Carrie, you could have picked the playlist next time. When we do round 2, we'll do a playlist. Yay, Nicole. Nicole, how was the process for signing up for you?
It was good. I did it. I also did it a while ago.
Oh, awesome.
But yeah, it's pretty easy.
Okay, great. I'm going to give everybody just a few more minutes as you work through that. And again, if any questions come up, feel free to jump off mute or throw them in the chat. And then once you're done, just type done in the chat so we know to move forward. Awesome, Naz. Great job. Okay, Casey, while you're finishing up, I'm going to move to the next slide that just gives us an overview on the app, so you won't be missing anything. Okay, so the My Pacific Source app, this is our app that provides on-the-go access to all of your benefits. So you can access InTouch through your computer the way you signed up now, or you can download the app and have it right on your phone. So when I said that I have my ID card on my phone, it's because I have the app that allows me to have access to InTouch. On the app's homepage, you're going to see, again, view your benefits, access your mobile ID card. You can also find a doctor. Again, view your explanation of benefits, access the 24-hour nurse line, customer service, and a lot more. So the app is a fantastic tool to just have everything right in your pocket. If you go to your app store, the app looks like this little icon that's Pacific Source's logo in the top right. So you'll know that you found the app when you see that logo. And if everyone just wants to take some time and download that on your phone right now, that would be great. So you have it ready to go as soon as we get through this. Okay, thanks for that update, Naz. Okay, we're going to keep moving along into healthy resources. So keep your InTouch portal open, whether it's on your computer or you're downloading the app. Either way, you'll be able to access what we have next. So Teladoc is your telehealth benefit through Pacific Source. And when I say telehealth, that just means that you can access this care remotely. Teladoc is an affordable alternative included in your Pacific Source plan, and it gives you access to doctors right where you are using a mobile app on your phone or computer. The great thing about Teladoc is that you can get a consult anytime, 7 days a week, which is really fantastic, especially if you've been waiting for an appointment to open up with your provider, you have a sick kid, don't want to go into the office, whatever that might look like. Teladoc can also prescribe medication to your preferred pharmacy as well. So a great resource for you to access in partnership with your primary care provider. This is a great benefit for those non-emergency conditions like cold and flu, allergies, pink eye, stomach aches, things like that. And for adults 18 and over, behavior health therapies are also available. And the idea is that these can help with stress, anxiety, relationships, family problems, depression, anything like that. So again, another avenue for access to care, because right now we know that access to mental health providers is really difficult. So this provides just another option for you to access that support with your care plan. A little background on Teladoc is that every provider on Teladoc is a US board certified physician, and the average experience is about 20 years. So you're getting access to really high quality providers. There is no copay to use Teladoc, which I think is one of the big highlights of this program. Is that you're going to get access to care at zero cost to you when you utilize. And as Carrie said, the prescriptions and other follow-up appointments that come out of this might not apply, but know that when you access Teladoc, there's a $0 copay. Another highlight is that access to providers could be outside of your community. So that means just, again, greater opportunity for access to really high-level care. We're going to watch a quick, it's like a 40-second video that just encourages you to register for Teladoc. And then on the next slide, again, I'm just going to provide us with some time to register for your account, because what we find is that the benefit seems to be underutilized because when people need it, they don't know how to access it. So our goal today is for you to be able to access this. So next time you're sick, next time there's an opportunity with your dependents, that you just have the app and it's so easy to log in and most of the time get a same day appointment. So that's our whole goal with the next two slides. So I'm going to play this video and then we'll have space to register. Can you hear?
There's actually no sound to it.
Okay.
It's really just a visual. So yeah, great question. And just to call out, the prices here are not specific to your plan. That's just their default disclaimer that if you didn't have coverage or the coverage was not active at the time, that would be the cost.
Okay, so really quick overview on what registration looks like as you're going through the process. Oop. Okay, so let's take a moment together to walk through registration. So you already have your InTouch account open. If you don't, let's get back in there. Next step that you're going to do is hit the tools in the upper right corner of your screen. And then you're going to click on Teladoc Remote Care. What that's going to do is push you to where you need to fill out the forms. These include some information about your health history and some other pieces that will help Teladoc just get you into appointments faster. And then from there, you're all set up. So from there, you have the opportunity to go right into scheduling appointment or just closing out of your account and coming back to it when you need it. So again, I'm just going to give us a few minutes. And then if you don't get through your medical history, that's something that you can revisit after this presentation.
And just another call out that you can do the same setup by downloading the Teladoc app from your app store. And it's the same setup steps as far as just entering that information. And that's what the video was really showing.
So can I just share something about this really quick? So
Yeah.
I needed to get in this was kind of like during the holiday season, and I needed to get in, and I had a million things going at home, and it was on a weekend, and it like suddenly flashed like, oh, I should do this. This is instead of going over to urgent care, this is what I should do. And the beauty was I had to wait just a little bit, and I kept getting updates like, we're getting you in. But the whole time I was at home, like doing what I needed to do. And then suddenly, like, it was time. I like hopped on right there. They let me know they were ready. It was so slick. It was incredible. And instead of me like sitting over urgent care, which is totally a thing and is fantastic, but I just felt really pressed for time, and I was able to keep doing what I needed to do at home. And still I was, in line, and then got right in, got everything taken care of. It was amazing.
Yeah, we have a lot of really fun stories like that. I've gotten my kiddo logged in and done all the stuff, and he's had the appointment. At one point we were sitting on the side of the road, and we drove 5 more minutes to the pharmacy after the call was done, and the prescription was ready. Our HR gal happened to use it one time. Her baby ended up having an ear infection. And so instead of baby having to go out into the cold and all the elements and be exposed to whatever was going around the urgent care, she got to stay home. Dad was the only one that had to leave the house to go pick up the prescription. And by noon, they were all good and settled back in. So
Oh, that's so awesome.
lots of great stories.
In my experience with it is on the behavioral health side. So over the summer, and this is an ongoing problem, but for me to get in with a behavioral health professional I was on list for like 8 months, and that was the reality. And I just poked around the Teladoc site for behavioral health and got in next day with an appointment. And the awesome thing about the behavioral health side of things too is that you get to select your provider when you make the appointment. And then from there, you can make ongoing appointments with the same provider. So don't think that every time that you're having crisis or you feel like you just need to talk to someone, it's going to be a new face. There's totally the opportunity to build a relationship with these providers. And access is just super simple. And I've had a really great experience on that end as well. Okay, if we want to put some dones in the chat, if we're ready to move on. And then if you're watching the recording, you can just hit the pause button, which is a great part of having this tool. Okay, great. Awesome. Okay, let's keep on moving. So Active and Fit, I'm glad this is our first one we're jumping into. This is our gym membership program with Pacific Source. So some highlights I want to point out is that through the end of this month, so through the end of March 2023, that $25 enrollment fee is being waived. So if you've been thinking about joining a gym or been questioning if this might be the right time, you will get that $25 discount. And starting April 1st, 2023, that price is going up to $28. So right now when you sign up, the fee is $25 a month for our standard memberships. And a really fun thing about Active and Fit is that we also have a premium level membership where you might have access to some of the more boutique gyms in your community. But this is a really great opportunity to get discount memberships at your local gyms. I provided the path on this slide. So when you're looking at this and you want to get into Active and Fit later, this is the way you'll access it through InTouch. Okay, health education program. This is one that not a lot of people realize is right in your back pocket. So each member on the Pacific Source Health Plan gets access to $150 health education reimbursement per plan year. And years ago, this was designed for classes at hospitals. And today we've really opened it up to lots of different opportunities for you to access some health education. The restrictions that we have on this now are that it needs to be taught by a licensed or certified instructor, and it needs to be a class that promotes and health and well-being or enhances your quality of life. I wanted to include, in addition to what you see on the screen as some examples of what is included, some things that we see come through that we cannot or don't approve are like drop-in gym classes that require a membership or a stamp card, sports league fees to meet with a clinical dietitian, gym memberships, weight loss plans, or one-on-one education classes. So that's just a great framework when you're thinking about using this benefit, what's going to be approved and what might not. And again, you can find all of that information on our website, including the form that you submit for reimbursement. Member support specialists. I love to shout this team out, and I know Carrie does as well. Pacific Source understands that sometimes people just need some help, and we really want to support the social determinants of health side of things in addition to just accessing your healthcare benefits. So the member support specialist team are like magic workers who can connect members with resources to improve their quality of life and access to care. So some examples of if you're struggling to manage your care plan, access providers, or communicate with your provider team, the member specialist team is really there to connect you and support you in making sure that your experience is really top notch and you're getting all of the information that you need to be healthy and get to a stable place. Condition support. So if you are diagnosed with diabetes, asthma, COPD, coronary artery disease, or heart failure, or have a dependent with juvenile diabetes, you are eligible for our condition support program. And this provides access to ongoing support from nurses, health coaches, dietitians, and you also get a specialist to help you coordinate care, because we understand that there are a lot of key players when it comes to managing your health and wellness. So we want to be there to support you to make sense of what can be a really confusing time. And again, I put the number to our member support specialist team on here. And again, you can access this information on pacificsource.com. Okay, Quit for Life. This is our tobacco cessation program. And this program is really here to support you in quitting tobacco products. And the thing I really like to just highlight here is that members get unlimited quit attempts. So this isn't like a one and done, we kick you off if you're not successful. You can come back to this program as many times as it takes for you to be successful in quitting tobacco. Through this program, you have access to a quit coach, quick coach to support you in your journey. You get an awesome quick kit with tools to help you quit and replace that addiction with something that might be more healthier for you. And you also get waived copays for visiting your in-network doctor when you're talking about quitting tobacco. So some really great benefits if this is part of your journey. And again, you can register directly through Quit for Life, and I included their website and their phone number on this slide. Okay, Weight Watchers. We do offer a Weight Watchers benefit, and you'll see now they rebranded to WW. So if you see some contradicting things, it's all the same organization. So we offer $100 reimbursement for the in-person meetings and a $40 reimbursement for the online program. And I pulled some of your local studios that you'll see on the right. If there is a huge interest in this as well, it's something that your wellness committee and I can talk about having like an on-site group. So there are lots of options with Weight Watchers. If you're interested, and all of the requirements are listed here. I'm not going to go through them one by one, but if you're interested, this is all provided on the form that you access for reimbursement on our website, and then you can access it on this slide. I'm going to pause. Are there any questions before we move into our next and final topic? Are there any benefits that you're really excited about?
I feel like I always hear talk of massages.
Oh, massages.
Is that a
Carrie,
thing?
you want to take that one?
Is that not a thing?
Yeah, your benefit committee has done a really great job of making sure that Bethel members have access to massage through their plan. So we didn't hit on that specifically today, but yes, you do have coverage for massages, and yeah, that is you can reference that on the benefit summary. So
I go to my chiropractor and he recommends massage, and I go and do my copay, and
yep,
there for an hour, and it's amazing.
yeah.
Ooh, Nicole, I need your chiropractor's number. Okay, I'm going to take no other comments as you're excited about all the benefits. So we'll keep moving.
Okay, so next we're going to talk about the services that we have through Pacific Source Administrators. So they are our sister company. This may be most commonly known as your flexible spending account or FSA account. So if you have one of those and you've chosen to save yourself some taxes by accessing this benefit, this part's for you. If you don't know anything about it, Nathan is your guy. So go ahead. Perfect. So just like we have with the Pacific Source health plans, we also have a mobile app for the administrator side. In the lower left here, you can see that emblem. We really do encourage you to download this. I have been able to stay out of the penalty box and keep my account active by utilizing this resource. It's super user-friendly. The purpose of this app in your guys' situation would be those claims that you are having reimbursed. If there's any additional documentation that you need to supply us, that would be where you can upload that information. So sometimes you get letters in the mail, hey, we need documentation on this. That would be how you would do that. Another example of why you would want to have this app is your guys' system is set up so that you have what we call Easy Pay, which is super great because that means the health plan side sends your information over to the administrator side, and we automatically reimburse you for any claims that you've had. But where that might fall a little short for things like over-the-counter medications or your first aid materials, things like that, and you want to utilize that money for those benefits, then you can actually submit a claim through this app. So that would be one of the probably higher utilized items through this. Go ahead. So this is kind of some examples of what that would look like. So you can see where it says limited purpose FSA, yours would just say FSA plan, just like what the HSA plan there looks like. So you can just click file a claim, view your expenses, things like that. And then it really just is pretty simple and walks you right through that information. So to set up your account, you're going to want to make sure that you log in through the website first. So that is right there at the top, psa.consumer.pacificsource.com. And you'll want to enter in your Z-Man number is what we call it. So that's like your membership number. That will have come in a letter from us. It's in the upper right corner. I'm looking to Nathan to see if maybe he has that also.
Also available in Employee Access.
There you go. So that's a super important number. But if you'd like to have the app, you'll go to the website, you'll set up the account, and then from there you'll just download the app and enter in those credentials again into the app. So that's how they have that set up. And then again, you'll just be able to access the features just as you see on the screen here. So with that, I think that was all we had for them. So again, thank you for your time. And if you have any questions.
Hey, Carrie, I had a question for you. So I know you touched on this right at a little bit at the beginning of the FSA. So if someone's like, yeah, I don't have that set up, I haven't talked to Nathan about it. Can you also capture that again? Just what that might be, when you want to use it, that would be great.
So what is a flexible spending account, Carrie? Got it. So flexible spending. So the IRS allows us to set aside X amount of dollars prior to being taxed on our income for medical qualified expenses. And so you can either go to our website or you can even go directly to the IRS website to see what a list of those expenses were. As a mom of 2 boys, I found it very beneficial to have that account pre-funded for me. So that way, as they did really goofy, silly things, I could cover those x-rays and doctor copays and prescriptions and all the fun stuff. I also utilized that and tracked with the orthodontist to do their braces over the course of 2 years, right? There's a discount oftentimes for paying in full or paying into payment, 2 installments if your braces go over a couple of year period. So I was able to, with both of my kiddos, to roll that over a 2-year plan, 2 plan years. And it was all pre-tax. So I saved myself a lot of money over the years using this tool. So what that really means in dollars and cents, if you will, is for every $100 that you put into the FSA account, it's really like you're only paying $75-ish, right? Depending on your tax bracket and all the stuff and things. So you really are saving yourself quite a bit of money. And again, it's once you make that election, that first pay period after the first of the plan year, that money is fully available to you. You can use it for doctor bills, prescriptions, dental, over-the-counter medications. Again, that whole list is on the IRS website. I believe we also reference it on our website as well, but super great way to, again, just have access to those funds and save yourself some taxes. And then I guess you do also do dependent care. I was really focused on the health side of that. So sorry. You can also do set aside up to $5,000 a family for daycare expenses. So if your kiddos during the summer go to like day camps, things like that, they can't be overnight camps, but Nathan can kind of fill you in on the details if you have specifics for that. But that's another great way to, again, save yourself some tax Any other fun questions?
Okay, great. I think if any other questions come through, Brooke can always connect anybody with Carrie is probably the expert on the benefit side, and myself to kind of work through anything that comes out of this presentation. So thank you all so much.